All right, welcome everybody. Thank you very much for joining. We're just allowing a couple more people to join and then we'll get started. But in the meantime, if you feel comfortable, please introduce yourself in the chat and we'll start to get to know who's in the room. We're really excited to share the product of our labors with you and to reflect on some of these findings. So my name is Meg Davis. I'm a professor at the University of Warwick Center for Interdisciplinary Methodologies in the UK. And I'm also privileged to be the principal investigator for this large consortium, the Digital Health and Rights Project. And today's a day when we get to share with you the results of our research over the past year and a half. It's been a very intensive and extensive project, the largest of its kind, using participatory action research to study digital rights in Colombia, Ghana, Kenya, and Vietnam. And what we're going to do is we'll have a brief presentation from my colleague, Dr. Bernard Koomson, who's a postdoctoral research fellow on the team at University of Warwick, but from Ghana originally, and a veteran participatory action research scholar. And then after his presentation, we'll then turn to our panel of experts and researchers from all the different countries we've been working in, as well as our community advisory team representative from Kenya, James Kilo, who's also with us today to represent youth participation in the call. And then we'd love to hear your questions, so please do use the Q&A function on Teams to share your questions or your reflections. We really want to hear your reactions to these findings. And we'll have time, hopefully, at the end to answer all the questions, and also we can continue the conversation online through LinkedIn, and we're still on X, one of the few who's still there. So anyway, for now, please do introduce yourself in the chat. And what I'll do next is turn over the floor to Dr. BK, as he is known to the team, to present our research findings. So Ben Koomson is a postdoctoral research fellow, for, as I mentioned, University of Warwick, originally trained in Ghana, who has been coordinating our study across the different countries. So over to you, Ben.
Thank you very much, Meg. Good afternoon to everyone, and thanks for coming. I will be presenting to you. Of course, I have the honor of presenting the result of our labor, our new report, which we have titled Paying the Cost of Connection, Human Rights of Young Adults in the Digital Age in Colombia, Ghana, Kenya, and Vietnam. Next slide, Javier. So you can really scan this QR code. I know Jack has also put a link in the chat to the full report, executive summary, and recommendations. And you also see in the annex study participants' recommendations as well. Can we move to the next slide, please? So this report comes on the back of the recent growing youth population in the lower middle income countries, and how this relates vis-a-vis with access to internet or digital platforms as well. In the past years, we have noticed that about 60% of employed youth in Africa use the internet, and this is just opposed by about 43% of those unemployed who still have access to the internet. And all of these come with its consequences and benefits in terms of access, human rights issues, which is what our study really aimed to explore, especially focusing on health. Next slide, please. So our study really hinged on these questions. We aim to explore young adults' experiences of multiple digital divides. Of course, we'll discuss most of the barriers, how criminalization, stigma shape experience of digital surveillance and community mobilization as well. We also aimed to explore the kinds of digital literacy that young adults require and need. And as part of the study, we're also interested in looking at lessons that can be learned from the HIV movement and how this can be transplanted to future mobilization and advocacy online, and of course, to look at the future of human rights in the digital age. Next slide, please. Next slide. Yeah. So this is a product of the Digital Health and Rights Project Consortium, which was established in the year 2019, made up of, it has really expanded to now 10 organizations in 10 countries, highly collaborative in terms of approach, participatory, of course. And you can see the logos of all the consortium partners beneath. Because of time, we can't go into that. But just to see that the DHRP consortium is hosted at the University of Warwick, and this project was actually also undertaken, as you have seen, in Colombia, Ghana, Kenya, and Vietnam with partners, some of our partners here. Next slide, please. So the research project, actually adopted a participatory action research approach. And as you are aware, PAR for short engages research participants in the design, data collection, sometimes analysis, and even validation of findings. And at the core of our PAR approach is what we call the community advisory teams, which are made up of representative for each of the research participants we studied, actually. And the CATs, for short, as we call them, helped us to co-design. They led some of the focus group discussions in all the countries, validated our findings, and are going to lead national advocacy plans, initiatives, and efforts as well. Next slide, please. Since its inception, the DHRP has really churned out very useful outputs, some of them knowledge-based, contributing to academic literature as you have them. We've also collaborated with international non-governmental organizations like WHO and the UNDP in particular, supporting the Special Rapporteur to Health as first reports, as you can see here. So welcome to visit our website and look at some of the publications we have. Next slide. Our main research strategy was qualitative. Proud to that, we engaged all the consortium members, especially our researchers in all these 4 countries, in desktop reviews, leading to the publication of what we call the country briefs, as you see in there, also available on our website. And there's also a forthcoming scoping review on digital literacy and human rights. This constituted the basis upon which we framed our questions, conducted 33 FGDs or focus group discussions with young adults in rural, urban, and peri-urban areas, 14 in-depth interviews, and also 41 key informant interviews as well, yielding about 4,000 pages of transcripts, which were all translated into English from Spanish, Sheng, Swahili, Twi, and Vietnamese. Next slide, please. Now, in terms of the distribution of the demographics, we had 302 diverse young adults in all 4 countries, identifying with various self-reported gender. Some did replace the normal gender identities you would have with their sexual orientation. And this is self-reported. This was what we stated in our protocol. Belonging to sex workers, sexual minorities, trans, rural women, and people living with HIV in all of the 4 countries. Next slide. So in terms of barriers to digital inclusion or access to online information, a top concern in all 4 countries was stigma, fear of privacy being exposed, and fear of being outed online. As you would see some of the quotes there. Now, this in actual sense led to a reluctance to engage online, and also led to mental health burdens and consequences. Some of the anxiety expressed was related to hacks, leaks, and private companies really selling the data of some of these young adults to others. Next slide, please. The issue of costs, which is, of course, the main thing in the title of our research report, also really featured prominently in engagement with our focus group participants. And as you can see on some of the stick-up notes that we have, costs relating to smartphones, airtime, data, and some had to go to the extent of telling us that they had to choose between paying for airtime and food to get vital health information online. For others in Kenya, they had really borrowed to the time to the extent that they had really been caught in mobile debt spiral, and that had led to a disconnection of their networks, and they could not really get access to the internet for very useful services. So the cost featured prominently, especially in Ghana and Kenya, or you can say economic barriers. Next slide, please. Also, 3/4 of our study participants described technology facilitated abuse, and we have conceptualized this to mean abuse committed, assisted, or aggravated or amplified by the use of digital technologies or carried out online. And we see this as increasingly being normalized as we learn from our project directed at people from sexual minorities, people living with HIV, and these types of abuse included fraud, hacking, blackmail, and falsified images shared to blackmail individuals. And sometimes it crossed over from online platforms to physical platforms as well. Next slide, please. Now, in the context of all these abuses, participants said that they lacked access to remedy or support. In fact, some had reported and had past experiences with the police and decided not to report. There were instances that the police did not actually, or authorities did not actually know how to deal with a situation like this. And so our participants called for law and policy reforms, the engagement of community paralegals, national HIV tribunals, and human rights training, which they call Know Your Rights training. Let's look at this quote from one of our transgender sex worker participants in Bogota, Colombia, saying, "I think that all of us have denounced at some point. We have complained, and most of the time nothing happens." So typifying the lack of access to remedy. Next slide, please. We see all of these barriers, inequalities, obstacles, overlapping and intersecting to deepen digital exclusion. Sometimes you could have gender inequality or identity leading to fears of data leaks, abuse online, and so on and so forth. So these are very complex and nested obstacles that lead to digital exclusion, and to the extent that some had to actually forego food just to sometimes get access to internet, and it is very, very, very disturbing. Can we go to our next slide? Nonetheless, we also found young adults who are demonstrating resilience and strong interest in digital future. They called for training in AI and digital literacy. As you can see in some of the quotes, some have called for an ideal future where internet is easily accessible and privacy is a must on internet or online spaces. Now, we have taken a step, and you can visit our Digital Empowerment Hub on our website to see some of the resources that we are providing for training, as was expressed by our research participants. Next slide, please. This is a case of resilience where in Vietnam, we had one of our community advisory teams, some of our community advisory teams, leading a very interesting intervention where an employee of an international electronic company had listed 16 partners alleging that she had transmitted HIV to them online and exposing them. Now, our CAT stepped in, reported the issue to local authorities, and 4 people were arrested and fined $7.5 million, which is 295 US dollar equivalent. So, typifying resilience and support online. In conclusions, we found that there are overlapping inequalities that intersect to deepen digital exclusion. Of course, these barriers are connected to each other, and there is the need to then take an intersectional approach to overcoming barriers to digital inclusion. We also see the rise in technology facilitated abuse among women, persons living with HIV, and we call for survivor-centered approach to strengthen laws and prevent and also respond to TFA, as we call it. There's also criminalization and stigma, which is very devastating, especially affecting the privacy of young adults living with HIV and key populations. And we have also called for rights to be protected. Individuals are informed more about their human rights online as it is offline, and also providing clear guidelines and structures for access to remedy. We have learned that in the HIV movement where all systems fail, community-led groups step in, and we've seen this coming up strongly online, where we had most of activists within the communities that we studied building strong communities online and weathering the storm in the face of abuse just to provide services. In one of the posts I post all the time about HIV. I don't read the comments. You never know. People focus on the critics, but there might be someone out there silently learning. Consequently, we argue that young adults remain resilient and are still calling for more training and meaningful participation in their human rights online. And we are extending a call to you to join the young adults and join all of us to take on this very, very amazing task. Thank you very much. Gracias. And come on. I hope I got the Vietnamese right to all of you. Thank you very much.
Thank you very much, Dr. Koomson. That was a wonderful presentation summarizing 4,000 pages of transcripts, many hundreds of miles traveled, including by Ben himself across all the different countries, working with each of the national teams. We'll have a moment to hear from our colleagues who've done the research in each of the countries. But first, I wanted to pass the microphone to my co-founder of the Digital Health and Rights Project. We've got 2 of them in the house tonight. One is Alan Meleche, who's about to speak from Kalen, and also I see Mike Podmore is on the call, and he also co-founded this consortium with us. So Mr. Meleche, let's pass over to you, and then we'll come back to the panelists. Thank you.
Thank you, Meg. I hope you can all hear me and see me.
Perfectly, thank you.
Yes, this is just for introduction, right, Meg?
The recommendations, if you would.
Okay, great. So before I go to the recommendations, I just want to again introduce myself and say how I am honored to be part of this consortium. And thank you, Meg, for setting up the webinar and the conversation. I am from an NGO called CareLink that focuses on health and human rights, and we work to advance health rights through legal and policy reform. And this report couldn't be more timely as we expand digital health. We must remember that we need to center human rights, not treat them as an afterthought. I know we are currently in an environment where we are facing a lot of challenges with uptake of human rights, respect of human rights, and respect of dignity. But this report is very timely because it's then emphasizing on the need to ensure that human rights must center what we do as we expand on digital health. I will quickly mention 4 key recommendations that largely came out from the study and resonate a lot within the Kenyan context and also the other countries. The first one is on access and digital exclusion. One of the key recommendations you will see in the report is that ensuring access to healthcare isn't conditional on digital access. Many communities we work with and the ones that are involved in the research, women in rural areas, young people who openly spoke about their HIV status, are left behind due to poor infrastructure, lack of smartphones, or expensive data. And so digital health must not deepen inequity. It must be able to ensure that everyone has access and there's no exclusion. The second recommendation was on technology-facilitated abuse. Dr. Ben has just spoken a bit to it, but there's been a rise in technology-facilitated abuse, particularly against persons living with HIV, HIV activists, sex workers, trans people, and even young women. There's a lot of increased cases of femicide in Kenya, which has even led to the government setting up a task force. And it's not just online harm, it actually bleeds into offline violence. And so we need laws and policies that recognize this continuum of violence and protect survivors while holding those who operate platforms accountable for the abuse that's happening on their watch. So that's extremely critical. The third recommendation for me is on rights, privacy, and participation. It could all be 4 recommendations, but we've lumped them together because one, there's need for stronger data protection laws and data protection laws that are tailor-made to the needs of a specific country, not just things that have been borrowed and copied from other regions, but those that speak specifically to the needs of a specific country. There's also need for public awareness on rights so that people are aware of their rights, who to hold accountable, and who to report to, and who to task to be able to deliver on their rights. And then the meaningful inclusion of affected communities in tax governance is an important area that we feel that when you involve those who are the most affected in designing, implementation, and rollout, then you get better results. And that's why we advocate for the meaningful and recommend for the meaningful inclusion of those affected communities. We can't talk digital health and justice without young people, women, and civil society, especially in low and middle income countries. We all need to have them having a real seat at the table. So those are the key recommendations that are very critical in this report, and we hope that we'll be able to sit down, discuss with various agencies, various partners, various governments on how ensuring access and digital exclusion is not a problem, ensuring that technology-facilitated abuse is addressed in both legal and formal systems, ensuring that rights, privacy, and participation are given priority. I turn it back to you, Meg, and thank you for the opportunity to intervene. Over.
Thank you so much, Alan. Always clear-eyed and eloquent as ever. So with that, maybe we can open this up for a conversation with our panelists, who I'll introduce briefly. I want to encourage everyone to please use the Q&A function to ask your questions. I see Alan has called out some of our partners at UNAIDS. We have the UN Human Rights Office, many national governments and civil society leaders in the chat, so we definitely want to hear from all of you. While you're thinking about your questions, let's first turn to our researchers. And you've heard a bit about the epic journey of this study, traveling across the countries to multiple locations, villages, cities, peri-urban areas, many different languages. These are the people who led the journey. So you've met already Dr. Bernard Koomson, also Dr. Javier Enrico Guerrero Castro is with us from Universidad de los Andes, a researcher who's worked with us for several projects now. Alberta Nadute, who joined us from NAP+ Ghana, is a research officer who led the study there, and Hoang Le Tu, a researcher from VNP+ in Vietnam, who also did an outstanding job leading the research in that country. And last but not least, James Kilo has joined us from the Kenya Community Advisory Team, who participated in the study both in an advisory role as part of that group and also as a so-called research assistant. He also facilitated some of the focus groups, especially in his own region. So welcome all. Really great to have you with us to celebrate the launch of this report. And we're both celebratory, but also it's quite a dark moment too when we look at the very serious issues that we were documenting in this study. I'm going to turn to Javier first and ask you to reflect a little bit on the research findings and especially on the issues around access. And how did those emerge in Colombia and what struck you about that? Thank you.
Thank you, Meg, and thank you for the question, because I think this is one question that is worth keep asking, because governments are already talking about, artificial intelligence and how artificial intelligence is going to change everything and it's going to take us to a new world. But what we found in our study is that people are still lacking basic access to internet, and they have to juggle their lives around these issues. They keep constantly being asked to participate, to be included in the digital, but the means to do so are not there. And I can mention like a lot of examples, but I probably would like to concentrate briefly into one of those are young women living near Bogota, and it's just an hour and a half close to Bogota, and we went there, and what we found is that these young women do not have access. And the reasons are various. Obviously, as Ben and Alan mentioned, economic. People do not always have the money to buy expensive data packages, but also infrastructure. They are living just 1 hour and a half away from Bogota, and the infrastructure of internet is not very good. And also, I would like to mention the experience of women living with HIV in peri-urban areas. And this is one of those situations in which intersectionality plays a role. These women often do not have a job, so they have to depend on others to go to internet, and that obviously have an impact in privacy. So again, I can mention a lot of examples, but I will finish there. Thanks.
Thanks, Javier. We'll come back to you hopefully, because I want to turn now to Alberta, since we started talking about gender inequality, and not to make the one woman on the panel talk about gender, but Alberta, you've said a lot of very eloquent things about your perceptions and things you've heard from young women in Ghana in the course of this study about how the inequalities affected them, and maybe you could share a bit of your perspective on that. Thanks.
Okay, thank you very much, Meg. I must say, being a woman on the project kind of gave me some ideas, because in Ghana, for instance, certain topics are like open secrets. Even the normal topic of menstruation is kind of a taboo in some areas. So I really went to the field with that expectation to really listen to the challenges of the various diverse populations that we are working with, especially women. And I think when we pose the question of what challenges they are faced, the immediate the immediate response that comes is the cost of data. As we know, Ghana has no, there is no Wi-Fi that is free or available for everybody. So everyone has to depend on airtime to get their own bundles. And if I could share strictly from some participants who was living in a rural area in Tamale, who said not having money to buy the bundle is the biggest challenge. They might give you your pocket money, and then you are hungry, you don't have money as well. So you just have to make a choice, decide which way to go. So I think there has been extensive experiences of young women in their diversity that really experienced a lot of challenges with getting access to just data to go online, and not forgetting the issue of let me say stigma that is actually associated with it, because for women, and as was shared from Tamale as well, which kind of has an ethnicity that is quite different. Sometimes they have to really get permission from their partners or their husband to be able to actually use a phone. So there is nothing you can do without your partner really knowing about this, which borders down to issues of privacy. Basically, the person has to know everything in your life. So those are some of the challenges that I must say women or women in their diversity within Ghana are facing currently. Thank you.
Thanks, Alberta. And I think one of the things that really struck me in the course of the study was how these different inequalities intersect to deepen different kinds of exclusion. So as you just mentioned, the fact that in Ghana, and I think in many cases in Kenya, we heard that young women often had to deal with both lack of economic resources to pay for their own phones and their own data, and then these gender norms that meant that people were seeing young women as not necessarily needing to get online or needing access to information. And so all of these things then drive them to have to share phones with other people in the community or with family members, which then exposes them to stigma and potentially to bullying or abuse. And, as we mentioned in the report, we had this case of this young woman who was evicted from her home by her father in Kenya because someone sent her a text message reminding her to take her antiretroviral treatment. And this then exposed her as living with HIV to other people who shared the phone with her. And that left to her losing her home. So I just wanted to, reflect on that, which really emerged strongly in Ghana and Kenya, but not so much in Vietnam. And it was really interesting to see the differences between countries. But maybe Hoang, if you could share a bit how you saw stigma emerging in Vietnam and some of the issues that emerged in the study for young adults there. Thank you.
Yes, thank you, Meg. And I think that joining in this project is a precious chance for me to meet the key population and to see how stigma was happen in some case in Vietnam. So I remember that one case that I have found during this project, that a case that happened in an electronic factory in Vietnam. So it happened when false rumor claim a female worker has infected 16 colleagues with HIV. So what follow reveal how easily technology can weaponize personal information against us. So let me say a little bit about this case. So a college discovered these allegation and made a fateful decision. So they using the internal system, they access private employee record and to identify the female worker, and they share her photo, her phone number, and her workplace detail in the messaging group, and falsely name her as the rumor individual. So just in some minutes, the information spread like Wi-Fi across Facebook, Zalo. Zalo is something like a Telegram or WhatsApp in Vietnam. So the panic erupt and at the factory and in the local community and in some key population. So one of our VCAT member, also a leader in a key population, and he also confirmed for the true information and then stop the false information to be spread. So this case, from my experience, I think that this case demand reflection. So what safeguard prevent our system from being turned against those they should protect, or how do we balance transparency with the humanity? So the answers will determine whether our digital future in power or in danger. So this is just one of my experience when joining this project and related to the stigma. Thank you, Senova.
Thank you, Hoang. It's really powerful reflections. And I think maybe we just stay with this. I hate to stay with the dark side because I think you've introduced one of the few really inspiring cases from this research, which was this case of young people, young leaders in Vietnam, really leading a response online to cyberbullying and misinformation. But we did document quite extensive technology-facilitated abuse, and as Bernard mentioned 75% of our study participants talked about technology-facilitated abuse. And Ben, maybe you can reflect on this a bit, especially because in Ghana and Kenya, we saw what you call poly-victimization, right? With abuse moving online and offline. Maybe you can share a bit about what happened there. Thank you.
Thank you very much, Meg. Yes. And so we actually discovered a trend where abuse moves from online, starts online and moves to physical spaces where people are actually tracked, and or individuals actually using social media platforms to start an abusive relationship without the knowledge of some of these young adults that we engage, thinking that they have started very new, friendly, or other relationships online, only to discover later that actually there are individuals who wanted to just connect online and drag them offline to, in some cases, ambush them and abuse them physically, which also happened in Tamale. And what we also discovered was that in a case where individuals had experienced abuse online and had tried to seek remedy, the feedback that they have had further aggravated the abuse and led to other forms of victimizations with authorities because they were actually blamed for not really protecting themselves or not deciding to hide their identities and those that the communities that they identify with online, and that they were told that you are the own cause of the abuse, so you have to leave, and that further traumatized most of the young adults that we engage. So abuse starting and then increasing, aggravating as it unfolds, and you would see that in the end having multiple forms of abuse in some of these areas that we actually explored. So this is the extent to which we the data, the extent to which we discovered, and we are now concluding that there is a very thin line between abuse that occurs online and abuse that occurs offline, that each of these spaces can really serve as a springboard for actually aggravating abuse and so on and so forth. Yeah.
Thank you, Ben. Yeah, I think one of the things that really surprised us in this study, we didn't set out to study technology-facilitated abuse, and it really was overwhelming how it emerged as a dominant theme over the course of the research. And we really wound up calling for a survivor-centered approach. The policymaking needs to be in consultation with people who have experienced this abuse and to get their voices, just as Alan was just saying, at the center of the discussion so that the response is really thinking about what needs they have in terms of healthcare, mental health, et cetera. I want to pass over to James to share a little bit of a perspective as one of our youth participants in the project, a researcher, and how you see this kind of affecting young people, because it doesn't mean people aren't going online. You have to go online, right? So how are people kind of managing this contradiction? Over to you, James.
Yeah, thank you, Meg, and thank you for having me. So, yes, the inequities that we have seen in the digital health landscape has had immense impact on the behavior of young people when trying to access and share health information online. One, some of them are avoiding getting online at all, especially this is clear for key populations and for individuals who are sharing smartphones. For example, we had a female participant in Migori saying that I don't want my cousin to know that I am HIV positive. So because we share phones, I don't search anything on our shared phone, anything to do with health information. And others, others who also change their behaviors when they go online. And this is based on the risk profile, which they judge from the response of the people online towards key populations. Some have to pull down their posts. Some have to delete their posts after seeing what the response of the online users to other people, and the content which they are posting most of the time is actually a benign content. They are posting issues to educate their peers about HIV, to educate their peers about autonomy, sexual health, and such issues, which are faced with much violence from the online users. And another thing is that these things also are affecting some people disproportionately, as has been said by the previous speakers, especially in Kenya and Ghana. It was clear the intersectional risk for the gender diverse people, the LGBTQ plus groups, where they are facing this risk. For example, they say they are being judged not for what they post, but for who they are. That's what was a big statement which we were taught from Kenya, and say that if you are HIV and you're gay, people can just destroy your life at a single point with just a screenshot. And so for the people, and my reflection is that as young people, they say that the future feels to be so fast, but yet it is so unregulated. So young people recognize that the digital world is moving very fast, and the policies which we expect to protect us are not in pace with these changes. And this risk having that in the future we'll have a very chaotic future if we don't have inclusive and safe platforms. Another thing is that access, which we have been talking about for many years, it is coming to mean nothing if there's no safety. There's an increase in access for these digital platforms for young people in low and middle income countries like in Kenya. Many young people, albeit many challenges of data and cost, are able to get online to get this information. But there's no accountability for those who abuse others online, and therefore they are not getting the end product of what they're going to search there. And therefore there's no digital freedom for young people. And the thing, in summary, what the young people want is that they just want to be safe online. Not much. They just want to exercise their freedoms of citizenship, their freedoms of expression online, and seek the services that they want. Thank you very much.
Beautifully said, James. Thank you. I want to continue the conversation, but also start to bring in some of the wonderful questions that are coming through. So thank you to those who have posted, and please keep them coming. And I'm going to call on Alan first, because I see we have two people here who are keen to get involved in law reform, and in particular talking about the need to reform laws that could strengthen protections against discrimination and protections of rights of young people and young key populations. So Alan, this is your department, so I would really appreciate your reflections on how people can get involved in this. Questions from both Stella Maris and Karen Small. Thank you.
Thank you for the questions. I think they are very important questions, and the realm of law and policy is one that is not easy to engage in, but one that's very worthwhile if you get it right. So there are three ways to look at it. A, does your country have existing laws that protect people from discrimination, stigma, all the other rights abuses we've talked about? If the country has it, then the key concern you want to follow is whether then the people who are responsible for enforcing the law know about it, the judges, the lawyers, the police officers. Are they enlightened about the law, and what role are they playing around enforcing that law? And even members of parliament, if they have an accountability role over, say, the Ministry of Health, certain corporate companies through their parliamentary processes, how do they hold them accountable? And then where are countries developing laws, how best do you ensure that the lawmakers are informed about the vulnerable communities, the issues the vulnerable communities are facing, and how to be able to address them? And then, of course, where there are no laws, what becomes the nature of advocacy towards getting the laws into place and towards getting a framework into place? I know different countries have got different political environments, but the essence of having a legal framework in place is that it gives you some refuge and a place to be able to hold both the state, both the private actors, and also individuals accountable for any action that they take. But it's not only just for holding people accountable, it's also important for helping us know how to govern, how to ensure people respect other people's rights, and guide us in terms of what is expected of everyone. So the law and policy realm is a very interesting one, a difficult one, but one that is very useful to create a foundation in which we know everybody's rights, responsibilities, limitations, and who to hold accountable in case people's rights are violated. Back to you, Meg.
Great. Thanks a lot, Alan. Yeah, I think one of the things we've really seen is that even in countries where there are robust data protection laws, that they may not necessarily be well enforced, or people may not know much about what their rights are. I don't know, Javi, if you want to say something about the environment in Colombia, where I understand there are quite extensive laws and policies to address many issues, but it can be challenging to actually get action on some of these.
Yeah, thanks, Meg. That's what we are known for here in Colombia. But I think this is a challenge, and it's a challenge for a lot of countries. Also, because of part of the discourse from technological companies is that the pace of innovation is relentless, and we cannot challenge them with rules and regulations because otherwise the world is going to crumble. And some countries have fallen for that, and they have forgotten that they have a do with citizens, and that is important. So even if we have regulations, most of them are not being rightly enforced. And people in Colombia, for experienced people in Colombia, found that their data is traveling around places they didn't allow in the first place. And they are quite surprised to find that someone is calling them, that they found online something about them, that some company have their data. They're quite surprised to understand that their data is being processed outside Colombia without their permission. And that is often something that falls into the cracks of the tiny letter in those laws, and how these companies in the States sometimes collude to produce this kind of outcomes. And I think it's I think that actually that's an opportunity for people to start thinking about these issues again. And yeah, we have the opportunity to challenge those practices. Thanks, Meg.
Thank you. I see we have a lot of activists on this chat posting a lot of questions about advocacy recommendations. And I see a couple questions from Priyanka, who used to work with us in DHRP. So nice to see you back in the call. And Priyanka asks about community-led digital strategies or tools that young activists are using to build resilience and navigate hostile online environments. And I wonder if one of the panelists would like to speak to this. Maybe James, would you want to take this one on?
Could you please repeat the question?
Yes. Could you share more about any community-led digital strategies or tools young activists are using to build resilience and navigate these hostile online environments?
Thank you. Maybe to just share about what we are doing as DHRP, as young people, and as CAT and the DHRP, we have been planning a campaign. It's called Make It Safe campaign, together with Restless Development and young people from the 4 countries. And what this campaign is all about is creating awareness about these digital harms, and also building a movement to call for accountability and strengthening the existing framework that exists for responding to digital harms. And yes, so the Make It Safe campaign we have been planning with the Restless Development, and we are going to launch this week. And what we do is to use the experience and expertise that young people have to build communities and movements of young people to respond to the challenges and risks which were identified by this campaign. That is one thing that this campaign is doing. For example, you shared about the case in Vietnam, where young people have been working together to highlight the challenges that key population face, and just respond to those challenges. So I would say that what we are doing specifically as young people, just creating a movement of young people who are responding to these issues. Thank you.
Great, thank you. Yeah, so keep an eye out for that campaign, Make It Safe. We'll definitely be sharing that very soon, and definitely would appreciate everyone's support. I want to turn now to Robin Montgomery's question, and Robin's a longtime global health activist and human rights scholar. And so Robin asks how we get governments and decision makers on board, but also the private sector and big tech companies. And I don't know if someone on our panel would like to address that. I think it's quite challenging with the big tech companies, right? Because we see the guardrails really weakening at the moment with, limiting of content moderation and now allowing more hate speech. We are going to reach out to Meta to share the report and the findings with them, and they've been open to engaging in the past. But it is really challenging because there's also no reported data about the levels of technology-facilitated abuse. So it'd be really nice if we could all join together in asking for them to actually publish that data so we actually know how many cases there are, how many have been resolved, how many have been investigated. I think that would be reasonable for them to report that. But I don't know if others on the panel would like to address that. Maybe Ben or Alberta or Huang, who haven't spoken recently. Okay, everyone suddenly falls silent. But yes, it is definitely challenging.
Meg, I'm happy to make an intervention if no one else is available.
Please go ahead.
I think it's a good question by Robin, and it's not a very clear and straightforward way. I think one of the things we have been discussing as we do this study is, one, how do we proactively reach out to the private sector or even those who develop the tech and the apps to be able to let them know there are affected communities, there are people who are involved in this process. They may not have the technical knowledge, but they have lived experiences that they need to take into account as they are developing their technology or other aspects. And so that direct engagement with the tech companies needs to be something that we proactively do from our end as activists, as affected communities, as a starting point. In terms of the private sector, there have also been conversations around using the angle around ethical business practices, business and human rights responsibilities. How do we engage from that particular angle? Because there's also been global conversations around businesses being able to respect human rights. Of course, it hasn't been very well done, but it provides an entry point with various UN mechanisms in place that are trying to promote the conversation around the use of human rights in business practices to ensure that they don't cause more harm to people. I think the third part is playing that accountability role that Meg is talking about, where we try to get them to be transparent around their data, if need be, engage in lawsuits or strategic litigation that tries to push the boundaries around how much more can they be transparent, how much more can they be held accountable. And then lastly, of course, is trying to have more investments in digital literacy and know your rights trainings so that then the communities are able to effectively engage the governments and companies and tech organizations from a position of power and not vulnerability. Just the same way we had this campaign in the world of HIV when we were dealing with pharma, and how there's a lot of efforts made in treatment literacy that helped people living with HIV, those affected by TB, to be able to engage in meaningful conversations with the pharma companies, sometimes successful, sometimes not successful, but from a starting point, we probably need to apply the same concept to issues of digital rights and digital literacy. Back to you, Meg.
Thanks, Alan. Really helpful reflections. And I see our colleague, Kene Isom, who's also a graduate student at University of Warwick and a longtime HIV activist, is pointing out how young people are using social media to draw attention to, abuses when they happen online. So that's a really interesting example of using so-called hashtag human rights advocacy. And I just wonder, as we begin to wrap up, Alberta or Hoang in particular, any reflections on lessons we've learned from your work in national networks of people living with HIV? Are there lessons we can learn from that to apply to human rights advocacy in the digital age? Any reflections from either of you about that?
Yes, I think there are lessons we can learn because I think majorly NAPLAS depends on community-led response, holding the space for their own community because the terrain out there is not so conducive, looking at the issue of stigma and the various inequalities that they face. And then there is the double burden for people who are in their diversity, who are living with HIV as well. However, they've been able to keep the space, reach out to their people, and ensure people get access to the healthcare or services that they require. And I think some of these community-led channels or interventions are very important steps that we could look at because it's more or less like being open and being secret at the same time. We don't want people, we don't make the noise. Yes, we act on ground. So learning from these channels on how to reach the unreachable without necessarily exposing their identities or exposing their health or issues is something that I believe we can really learn from an organization like NAPLAS. Whilst we advocate for our rights, advocate for equality in our access to healthcare, because healthcare is basically a right for everybody and everybody deserves to have access to these services. Thank you.
Great, thank you very much. Hoang, anything to add to that?
Yeah, I just want to add just some small thing from the Vietnam key population. So after doing the project and meeting with many participants from every key population in Vietnam, and especially the young people, I found that the we know the problem is there, but this is the chance for the young people, especially from the key population, to raise their voice. And the result from our project is a good chance to for them to raise their voice and for the community to understand what are their problem, and especially in the way they looking for the health information. And I think for the audience, they can find the detail in the report, and I think yes, it should be a good picture for all the 4 countries. Thank you.
Thank you so much, Hoang. I'm sorry we don't have more time to chat. Some wonderful questions coming up. But please do follow us on social media and sign up on our website. I think we have another event coming up shortly that maybe Javier can just share that link with us now on the screen. While I'm doing my thank yous, so huge thank you to all of our panelists, Alan Maleche, Alberta Narute, Hoang Le Tu, Javier Guerrero C., James Kilu, Bernard Kumson, all of the Digital Health and Rights Project Consortium colleagues who helped make this a reality. And special shout out to Javier Garcia Martinez and Jack Wilson for organizing this webinar. And thanks to all of you for joining. We've really appreciated the chance to reflect on these findings with you and look forward to keeping in touch. Have a great rest of your day. Thank you.